Hi there, here we are again. This is Dr. Hart, Nursing with Hart, PhD. This is the next group of questions in this series on urinary and bowel elimination. The last video was on urinary elimination, and so this one is on bowel elimination. And I'm going to show you again this chart like I did on the last video. This chart is directly from the NCLEX NCSBN.org website. So just so you can see the relationship of these concepts and how much is the percentage of these concepts that will show up on your NCLEX exam. And this category that I'm covering today is basic care and comfort, which is 6 to 12%. I will cover other categories and I'll let you know what they are, just to give you an idea so you can relate to the importance of each category and where they stand with your NCLEX and what you can expect as far as priority. Okay. So the basic care and comfort category of the NCLEX test plan is to provide comfort and assistance in the performance of activities of daily living, and that's the nursing's job in this category. That is what the nurse will do. And the subcategory here is to assess and manage a client with an alteration in bowel and bladder elimination. So those are the two things I'm including in these two videos, and today I will cover bowel elimination. Okay, so here we go with first test question. Which factor is related to developmental changes in bowel habits for older adult clients? Is it A, increase in dietary fiber can decrease peristalsis? B, milk products cause constipation in clients with lactose intolerance? C, weakened pelvic muscles lead to constipation? Or D, older adults should peel fruits before eating? So some of these answer choices may look correct, but what you're looking for in the stem of the question is which factor is related to the developmental changes in bowel habits for older adult clients. Okay, not just any client, but the older adult is what we're focusing on in this test question. Okay, we'll give you a minute and then we will come back. I'm going to take this opportunity to encourage you to like, share, and subscribe to my YouTube channel, Nursing with Hart, PhD. I am also on TikTok under Susan Hart 63, or name is Susie Q on TikTok. I'm also sharing these presentations on TikTok as well. Instagram is coming soon. Okay, so let's go back to this test question, and the correct answer on this one is letter C. Weakened pelvic muscles lead to constipation, and this applies to the older adult. If the older adult, as the older adult gets older, the pelvic muscles get weaker, and it is more difficult for the older adult to defecate. And so this would be, it may even be painful. So the older adult is going to resist defecating, so that is going to lead to constipation. All right, let's look at the next one. When educating an older adult client on the prevention of constipation, the nurse should provide which educational intervention? And so this nice picture here gives you a clue to the answer. All right, here are your answer choices. A, drink 3 glasses of milk per day. B, eat 6 servings of bread or pasta. C, consume antacids to decrease reflux. Or D, increase intake of fresh vegetables? All right, we'll give you a minute and we'll come back to this test question. Okay, so we're looking at patient education here, and we are educating the older adult client on how to prevent constipation, which is a very common thing, common problem in the older adult because of many factors. So when educating the older adult on the prevention of constipation, the nurse should provide which educational intervention? Okay, and the correct answer is letter D, increase intake of fresh vegetables. Okay, educating the older adult to recognize that decreased frequency of bowel movements is usually a normal result of aging. But they should also, when you're educating the older adult, encourage them to change the dietary habits to increase the amount of fluids and high fiber foods in their diet, and that will increase activity, bowel activity, to prevent constipation. Okay, so fruits and vegetables are very good, especially for the older adult, to help prevent constipation. Okay, so let's look at these other answer choices. Letter A, drink 3 glasses of milk per day. No, milk products are not going to help prevent constipation. Letter B, eat 6 servings of bread or pasta. Again, bread or pasta is not going to help prevent constipation. And letter C, consuming antacids, also not going to prevent, has nothing to do with constipation. Okay, let's look at the next one. Ignoring the urge to defecate on a continual basis leads to what? A, sudden increase in stool with mucus. B, constipation and hard stool. C, need to increase milk intake. Or D, total loss of bowel control. And we'll give you a minute and we'll come back. Okay, and the correct answer on this one is letter B. Letter B as in boy, constipation and hard stool. So ignoring the urge to defecate, and this is something else we need to educate our patients on, ignoring the urge to defecate may lead to, okay, constipation and hard stool. So the longer the feces stays in the large intestine, the more water is absorbed, and the result is harder, drier stool. So that's the job of the colon, the large intestine, absorbs the water from the feces, which makes it harder and harder to defecate. Okay, let's look at the next one. Which medication causes constipation? These are very important for educating your client on how to prevent constipation. A, magnesium antacids. B, bisacodyl. C, aspirin. Or D, iron supplements. All right, we'll give you a minute on this one and we'll come back to it. Okay, we're back, and so the correct answer on this one is letter D, iron supplements. Okay, this is a common side effect of iron supplements is constipation. Let's look at these other answer choices. Bisacodyl, what is that? Bisacodyl is a stool softener, okay, under the brand name usually Colace or Docalex, okay? So that is a stool softener that would not cause constipation. Aspirin is an analgesic that does not typically cause constipation. Magnesium antacids help to decrease heartburn, and they don't usually cause constipation. Okay, let's look at the next one. I think we have one left. The type of stool that will be expelled into the ostomy bag by a client who has undergone surgery for an ileostomy will be A, bloody, B, mucus-filled, soft semi-formed, or D, liquid consistency. And I have seen and used this type of test question many times. Okay, this is something the nurse should know and be aware of. So we'll give you a minute to think about it and decide which one you think is correct. Okay, we're back. Okay, and the correct answer on this one is letter D, liquid consistency. So the stool typically coming out of an ostomy bag for a client who has an ileostomy, okay, is going to be liquid consistency. Okay, the ileostomy output is naturally looser or liquid because the colon, which normally absorbs the excess water, is bypassed in this case. Okay, with the ostomy, specifically ileostomy. Okay, the colon was bypassed, so there is no chance for the water to be absorbed. So there is a lot of water in that stool, which is going to be a liquid stool. Okay, so stool produced from an ileostomy is liquid and contains large quantities of electrolytes. All right, and that's it for this one. We'll see you on the next one, okay? And have a great day, everybody.